I would start by saying that, first of all, I was a member of the Toronto Board of Health for the first 2 terms in office, and this term I'm not a member of the Board of Health, so forgive me, and Brian, I'm sure will correct me if I'm a little bit out of date on some of the things that Toronto Board of Health has done in the last couple of years. But I want to start by saying that I'm also as well an early childhood educator. I have been active in childcare for many, many years. That's my background. But I'm also a member of the Toronto Public Library Board, and I've chaired the Community Development and Recreation Committee at the city for a few years and been on that committee for some time as well. So the human service side, and children in particular, are things that I care passionately about. And one of the things that I care passionately about and feel very strongly about is advertising to children. We can, and I hope I don't ruffle feathers, but we can offer all the programs we like. We can do all the education we can afford. We can try and use various ways to influence public opinion, but we are up against the most incredibly powerful interests in the world. Corporate advertisers and huge corporations have incredible power and are willing to exercise it in any way they can to influence public policy. And when we saw that at the Toronto Board of Health, when we began to talk about restricting advertising, whether it was to develop a policy to restrict junk food advertising only, instead of an all-out ban of advertising to children, the industry came out in full force. And they came and told us about all the wonderful things they were doing, and I don't know if any of them are in the room today, but I don't see eye to eye with these folks. Because when you look at what the industry is prepared to do in terms of self-regulation, it's not good enough. What the food industry says is healthy choices for children are not healthy choices for children. They're still covered in branding, they're covered in cartoon characters, they're covered in various inducements so that children who are unable to developmentally to understand that they are being sold something, they're unable to distinguish what it is that's happening and what impact it's having on them. And, you know, we can do media literacy when children reach a certain age, and we can try and get them to recognize that these ads are intended to influence and are intended to convince them they need and want these products. That doesn't happen for some time. And by that time, you've got kids this size who've been developed brand loyalty. That's what it's all about. It's about little kids seeing over and over again wonderful, colorful, happy, friendly cartoon characters and color and music, and not just on TV now, but on the internet. And you sign up for clubs. They have sucked children in new ways we've never seen before. Putting children at risk even, because you have to put in personal information often to be able to play that game that your children want to play. So I'm a proponent of an all-out ban, and I really wish I had been here to hear is it Suzanne from Quebec?
Susie Battle?
Susie. Yeah, Susie from Quebec. Because what they are doing is the right thing, and that's the direction we should all be taking. I forget the results. The results were a 10 to 15% reduction in childhood obesity from cutting advertising. Much cheaper, very efficient, and effective. So I recognize the suggestion, and I agree with the earlier suggestion from the previous speaker, that you have to be careful about the timing of when you do things when it comes to trying to push the public policy yardsticks. I don't speak for, my perspective is at this point not the perspective of our current mayor or council. And in this environment, you may not want to take risks. You may not want to get right out there pushing things in case you lose. Because if you lose ground. So at this point, one of the good things that public health did was public health passed a policy that said we're going to advocate, we're going to work with the other divisions and other levels of government locally, as well as we're going to advocate at the provincial and the federal level for legislative change. We're going to work at the local level. We're going to start looking at how we can influence what's happening within the agencies, what we call ABCDs, the agencies, boards, commissions, and departments at the city. And I have to say, I was asked to have a title for this, and I didn't ever come up with one, and I didn't submit a presentation. But I was going to call it "You Win Some, You Lose Some," and we've won some. Children's Services. Not only do we have a new and improved local procurement policy, we also have developed a very clear advertising policy in Children's Services that Children's Services does not advertise to children in any way. We have, when I look at we have the Toronto Transit Commission, Parks, Forestry and Recreation, Children's Services, the library and other ABCs have all are doing something around advertising. And I forgot to say that one of the things that, the thing about advertising and governments is that advertising is like a drug. The more you think you can make revenue out of partnerships, advertising, the more local governments are doing it. And I happened to attend a conference, a little session at the Federation of Canadian Municipalities, who brought in the P3 specialists, some of the top P3 specialists in Canada, who were teaching municipalities how to sell their properties. And you know what properties are? The definition of properties is everything. They could sell everything. You could sell advertising anywhere on anything in tax bills even. So governments are so desperate for funds, they are looking for additional revenues and are prepared to start to sell off almost everything. So it's really important that we ensure that where there are going to be partnerships, sponsorships, advertising, that we try and influence the policies surrounding those. So at the city, we now have approved a sponsorship policy, a donations policy, a naming policy. I forgot about namings. So if you want to sell off the name, you won't be able to recognize public buildings anymore. They all are going to have corporate names on them. Now, we've approved a policy, a framework of a policy for all of those things for the big city corporation, and we weren't successful in getting no targeting to children in that policy. The City of Toronto has street furniture, we call it, bus shelters with ads all over them. And we do not have a policy that says we don't advertise to children, because those venues and those mechanisms are not specifically targeted to children. They're open to the general public. But where we have been successful, and I have to say I'm very pleased about it, is at the library. The new library board is a very different new library board. It's different than any of the previous boards I've been on. And their number one issue when they came to the first budget was, how do we make money? And what do you mean we can't charge user fees? well, if we can't charge user fees, how are we going to charge our users and make more money? So they've decided to have advertising. They're going to advertise on the back of bookmarks. They're going to advertise on the back of due date slips. They're going to advertise in the city, in the library itself, on computers. They're going to advertise on every computer in every library. They're going to advertise in other markets where our private consultant, whose job it is to go out and find us people who will buy whatever the library has to sell. We may advertise on other things, on our trucks. So the potential for advertising in the libraries, sadly, is there now. And we will be leading edge in Toronto advertising in libraries. So if in Ottawa, watch out, and anywhere else. The one thing, though, is we have a specific policy that says there cannot be advertising targeted to children. And I've brought, I don't know, about 25 copies of the Toronto Library policy, but it is very specific. So it's a section that promotional messages that specifically target young people by being broadcast, shown, or displayed to an audience that is primarily children. For the purpose of this policy, a child is anyone under 12 years old. And it talks about the medium, that it has to be presented in a way that is animation, cartoons, etc. Time and place where there's children. It's intended to sell a product, essentially to market a product that's a children's product. So I think it's quite consistent with some of the language in the Quebec legislation. Of course, you probably heard the Quebec legislation was tested through the courts. So we've heard nothing about these restrictions, but it's because we haven't had advertising in the libraries up until now. So that's helpful. On the side of on some of the other areas where we, of course, want to continue working is in children's services, and they also now have, I think I already mentioned that, a ban on advertising to children. So the voluntary regulation, I don't think works. Doing more education on healthy choices, obviously, are good things we should continue to do. But I think that the best way is to try and garner the support we need, both at the local, provincial, and federal levels, to prohibit advertising to children. All advertising. Because there is no sort of, how do you sort through? We only are going to ban advertising of unhealthy food. Where do you define? How do you define unhealthy food? We certainly couldn't rely on the industry to define it. They clearly defined it in such a way that still allows Fruit Loops to be a healthy dietary choice. So I think we should be looking to Quebec as the model and continue to push. Now, we also in Toronto, though, have a very effective local movement. Tell me how much time I have.
You're good. You have about 5 more minutes or so.
That is called the Public Spaces Committee, and it's a group of young activist types who also have been critical to influencing when and how we allow advertising in the public realm. And we're very effective in establishing for the first time a very tight billboard sign bylaw in the City of Toronto to try and restrict where billboards go in the city. If you go to Yonge and Dundas, any of you who haven't been there, if you're from out of town, you'll obviously recognize it's one of the areas where we allow billboards, and we allow illuminated billboards with video imaging. But there are only 2 places in the city that allow that kind of signage, and we have absolutely restricted where signs go in other areas. So that sort of activist, public space, public planning, the people who want to look at how we build beautiful cities, they can be good allies. I think we need to do more work to collect more information about where advertising exists, how much advertising is out there for kids in the public realm that we know about now. We should be working obviously across jurisdictions to school boards and the nonprofit sector, wherever we can reach children and families, and continue to recognize that children are vulnerable. They can be influenced so easily. And it is those healthy choices that get embedded very, very early. So I think I would just wrap up by saying, first of all, congratulations, which I meant to say to the Ontario Public Health Association. You have taken a very clear position. I think it's excellent. And if you and your leadership could be spread across to other jurisdictions around the province by doing more of this and sharing with other municipalities what some of the other municipalities have done would be very helpful. And public health, I want to say public health has led this work in the City of Toronto. So it is public health that has worked behind the scenes with children's services, worked behind the scenes with Parks, Forestry and Recreation, worked behind the scenes with the library. You have a way, you are highly respected in public health. You are research evidence-based and highly respected by elected politicians. And I would just ask you to continue this great work. And I'm happy to take questions.
Well, I would like to thank our last two speakers and to everybody else for hanging in there the late hours of the day. I think we've learned a lot this morning and this afternoon, and thank you very much for your time. And Sumi, I think you have some closing comments for us? 10 seconds.
10 seconds, I promise 10 seconds. So I hope you have all found that the day met your expectations. During the course of the day, you were introduced to a sense of the current state, both in Ontario, the other provinces and territories, and Canada and other international jurisdictions. Various policy options and possible ways to address marketing towards children that can be undertaken at the national, provincial, and local levels. The desire of the steering committee was to present you with a comprehensive picture on the issue of marketing towards children that provided both depth and breadth. And we hope you enjoyed NRC's inaugural event. So if you haven't already, please complete your evaluation forms that are currently in your package and just leave it at your desk or on the registration desk. There is a sense with regards to this issue of marketing towards children that the clock is ticking in light of concerns over childhood obesity. It is a concern, especially as Brian has pointed out, that children's marketing is intended to create adult loyal consumers, and especially where the concern around prevalence of obesity is increasing. A growing sense of increasing the scale of our actions, both at the local and provincial level, is probably required. So I hope you have found this day informative, stimulating, and interesting. And I would like to thank all of you for attending, all of the speakers and presenters, the steering committee for their work in putting together this agenda, the volunteers, and my staff. For those of you who want to learn more about Ontario Public Health Association, what it is we do, some of you may be aware or may not that Brian Cook actually is a chair of a Marketing Towards Children network, an exchange network that we have. We always welcome new members, and that's a forum whereby you can hopefully put some action together and put a voice around this issue at the provincial level. There's a membership form in your package if you want to learn more about OPHA or consider being a member. We're extremely inclusive. And I wish all of you safe travels home and hope to see you at OPHA's Fall Forum and also at the next NRC event next year. So thank you again and all the best.